Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hardworking Americans and their families? You will. This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefit in benefit plan. Now prepare to learn, plan, save, and protect with the Phia Group.
Hello, everybody. It's me, Ron Peck, Chief Legal Officer at the Phia Group. I am so pleased to join you for yet another episode of Empowering Plans with the Phia Group. You know, I was thinking about how we've been doing this podcast for years at this point, years. And I'm remembering sitting at the table with Adam at our old office doing these podcasts, and we were sitting next to each other. So I was really kind of staring at a wall. And I think there was a water fountain over there, and I think there was a bathroom. You remember where this was? We were located outside Juliana's office.
I remember, yep.
Yeah, in that space. And so I'd stare at the wall, and when Adam would speak, I kind of crane over and look at him. And Pat was actually off to the left, left. So I didn't really have to look at him, thank goodness. And Adam was to the right. And so I would look over at the right when Adam would speak. Well, now Pat is over at the right. Just by instinct, I keep looking over and I see Pat instead of Adam, and it kind of surprises me every time. Whoa, you know, what's going on over there? What's going on over there is that Pat is producing this podcast. What a hero. Seriously, if you've sent him gifts, send him more. If you haven't sent him a gift, shame on you. Now, speaking of shame, I feel shame every time I look across at this incredible human being here with me, Jen McCormick, because whenever I think that I understand something, that I've reached the pinnacle of knowledge in any area in our industry, Jen comes into the office, asks me a question, and just puts me in my place. And I realize I don't know anything. So Jen, thanks for being here with me to make sure that not only I, but all of our listeners actually learn something today. How you doing, Jen?
What an intro. It is nice to actually look at you instead of a wall.
Yeah, don't be intimidated,
Yeah.
okay? And frankly, I am like a wall, right? I'm solid, nothing gets past me, you know? You can hang things on me, and I promise not to move. So we're going to talk about some issues that have really been bothering us lately. And when I say bothering us, it bothers us not only as the Phia Group, consultants at large, where clients are coming to us and asking us questions about these things, but we're an employer too, okay? We've got hundreds of employees, most of them full-time. They're all over the country at this point. We have nearly 200 employees on our health plan, not to mention dependents and spouses and you name it. So as an employer, even if we were producing widgets here and had nothing to do professionally with the health benefits industry, we would still be dealing with the issues that are popping up today, just as an employer, right? Assuming that we don't just punt it and ask somebody else to deal with it for us, which, yes, in our industry, you see a lot of that blind faith, but then the entity to whom the issue is being knocked over to, whether it's a broker, administrator, carrier, whomever, well, then they're the ones coming to us with the issue. So somebody's got to deal with it. And we're all kind of running around wondering who's got the answers. Two of the big issues that I know we want to talk about today both relate to the Consolidated Appropriations Act, or the CA, and park the CA in Harvard Yard, right? Oh, man, geez, yeah, this was perfect for us. But there is no R at the end of this act that I'm leaving off. It's actually the CAA, okay, not the CAAH or CAAR, and I'm just leaving the R. But anyway, when we're talking about the CA, and what a cat is, it's driving me insane. But there you go.
Oh, it's a good one.
Insert the sound effect there. Two of these sort of primary issues that have popped up as a result of both that and all of these sort of downstream regulations and executive orders and sort of progeny of this original act. One of them relates in a lot of ways to the No Surprises Act, okay? And I've written about this, I've spoken about this, and it's still an issue that I think isn't necessarily getting enough attention. That's one. And I'll tell you what the issue is in a second.
Oh, I can't wait. Okay.
I mean, you know, it's the build up. We got to cut to a commercial, right? I want you to stick around.
Right.
Don't touch that dial, folks. And the other issue that we're going to talk about is the executive order since then, where we're hearing about requiring either a vaccine, so mandating a vaccine, or testing, which I think is fascinating because before we get into the CAA and the other issue I want to talk about, I remember when the ACA and Obamacare and all that was kind of passed and we required everyone to have insurance. And really we were telling people, look, either you purchase insurance or you pay a penalty. And then we're going to collect all this money from all these people, put it into this big bucket, right? And then we're going to use all that money to then pay for the people who need it, which is funny because if you think about it, everybody's paying, right, the salary of the fire chief, the firehouse down the road from my house, but not everyone's house is burning, right? So we're all paying in so that if somebody needs it, fire department is there to put that fire out. But we're paying through our taxes, right? Federal, state, local, whatever it is, you pay a tax and that money is used for the benefit of society. I understand the purpose of a tax. Sometimes it irks me to have to pay it, but I understand why I'm doing it, right? And of course, we learn in school all the time about the elderly citizens who their kids are all grown up, right? So their kids are not in school and how it bothers them as retirees to have to pay taxes that go towards the public school system and how they're looking for, which state can I move as a retiree where the taxes are less, because if I'm not using it, why should I pay for it? And it's just interesting that this sort of anti-tax philosophy or this feeling that, look, I don't want to add to people's burden. I don't want to add to people's taxes. That's not a popular thing to do. I'm not going to win the next election if I'm seen as a politician who's dinging and danging everybody and coming after them for their money. So instead, what I'm going to do is I'm going to force them to pay premium for insurance instead of a tax to the government. But ultimately, what are you doing? You're forcing employers and insurance carriers to act as the tax man and collect money from everyone to fund this healthcare for society.
Mm-hmm.
That's fine. They did it once. And by golly, they did it again. Now, once again, instead of a tax, what is it? I don't want to require vaccines. I don't want to declare a national emergency. Last time we did this and forced everyone to click it or ticket, they got mad, right? They don't want to wear those seatbelts. And we took a real hit that time. Now, everybody buckles their seatbelt. They don't think about it twice. But for a while there, us politicians were very unpopular when we passed that law. So instead of requiring it again, we're going to let the employers do the dirty work for us. We're going to require them to either test people or hopefully when they realize that it's cost prohibitive, mandate the vaccine. And I get to wipe my hands of it and say, well, I didn't require it. Blame your employer. So I feel like as an employer, we're doing a lot of the government's dirty work. Maybe that's just, I'm paranoid, but that's how I'm feeling right now. So the one thing I definitely want to touch upon really quick before we get into that is the matter of appeals versus a dispute. We've been dealing with appeals as long as benefit plans and insurance have been around. There have been appeals. And prior to the ACA, prior to Obamacare, it was pretty simple. If you don't like what you got, and it's funny, they used to say to the kids, right, you get what you get and you don't get upset.
I know.
But then I've learned, you shouldn't really tamp down their emotions. If they want to be upset, then they have a right to be upset. Now maybe they'll have to work through that. But the point is, it's okay to feel upset. Don't just take what's given to you.
That's right.
So the point is, you say to a provider, say to a beneficiary, say to a plan participant and patient, hey, don't get what you get and get upset. Be upset. Go ahead, file that appeal. We'll work through it together and we'll figure out whether you got the right amount. Now, the point is maybe it was denied because of an exclusion. Maybe it was a reduced payment because of some sort of UNC pricing. But the point is, if you got less than the amount to which you think you are entitled, it's a simple answer. Appeal it, right? It's almost like one of those television commercials, right, as seen on TV. You don't like what you got? Appeal it, right? Oh, watch out for that mess. Appeal it. It's appeal it. It works for everything. So simple back in the day. The ACA took that and expanded it, expanded the types of situations that could give rise to an appeal. It formalized the process. It added more steps. It brought to our attention more of the fiduciary obligations. And we, as an organization, we responded to that. We came up with services and products that were meant to help these plans with it. But even though appeals became bigger and scarier, there were more of them, they were more complicated, and it added value to our service, so I'm not going to knock it. It was still appeals. The appeal got bigger, the scope got bigger, but they were still appeals. Now with the No Surprises Act, you have these disputes where you're not happy with what you got, but you're not appealing anymore. It's something completely separate. And I know a lot of people, they say, well, Ron, who cares, right? Ultimately, what does it matter, right? If I have to pay more, I have to pay more, whether it's in response to an appeal or in response to a dispute in the No Surprises Act. But Jen, correct me if I'm wrong, it matters. It matters whether this is something that should be appealed and go through the appeals process, or is a dispute over the price or the payment amount under the No Surprises Act. It matters.
Right. Yeah, and taking it back before we dig into the dispute versus the appeal, if we remember, some of the ACA rules were to help make a more uniform and consistent path for how we would handle appeals.
That's right.
We used to have grandfathered and non-grandfathered plans, which we still do, but the rules at the time pre-ACA were all over the place. And by putting these rules through ACA Obamacare into place, it was trying to create some uniformity in how the appeals process was going to be handled for participants. And that's been working or so for 8 years. And now they're getting thrown for another loop. We're adding another path, another channel, another tunnel here, where plan participants are going to be forced to have to figure out which path for their particular claim. It's going to be even more confusing than it already is by having to decide, is this subject to a dispute or is it subject to an appeal? And why that matters is because there are some nicely laid out rules in ERISA for the time frames that they'll have to submit a claim, submit an appeal, a second level appeal. But for a dispute, what's that process? We're still working through that. Some rules have been released, but it's a whole other hurdle they're going to have to figure and work their way through when we just got to the place where we sort of had some consistency. So this is making a mess for participants, I think.
Yeah, and it's funny because, people have said to me, well, Ron, if the claim is denied, because it wasn't medically necessary, it was a cosmetic procedure, experimental investigational, sort of the classic exclusions, right? Then $0 are paid, whether they're in network or out of network, whether it was an excessive charge or a very fair price.
Right.
0 is paid. And if they want to argue that that exclusion does not apply, go ahead and file an appeal. I understand that's a clear-cut appeal. Likewise, you have a out-of-network specialist providing a service at an in-network facility.
Any outies, right?
Any outie is what I call them. Thank you. We should coin that term. So in-network, out-of-network specialist, out-of-network charge, it comes in, it's not excluded, it's medically necessary, it's clear-cut, this is a payable claim. So they go and they apply their out-of-network pricing methodology, whatever that is. We'll say it's a Medicare-based, reference-based pricing. They pay it, the provider looks at it and says, yep, you calculate it correctly. This is absolutely what the plan document says I have a right to receive, but I'm still unhappy with what I got. So now I'm going to dispute it and take it under the No Surprises Act since I can't balance bill the patient anymore, according to this rule. So that's maybe a clear-cut dispute under the NSA. But what if the provider gets that payment and says, look, I don't actually have an issue with taking Medicare plus 50%, but I think whoever your repricer is calculated it incorrectly. Because my cousin works for CMS. He reprices claims at Medicare rates for Medicare. And I ran it by him and he says, you underpaid me. Even if you're paying me Medicare plus 50%, you still owe me more. Is that a dispute under the No Surprises Act? Or is that an appeal because I'm arguing that you misapplied the terms of the plan? I don't know, right? So, but the point is there's going to be some confusion. And, you say to me, well, Ron, I don't know. Well, do we want it to be? Do you want it to be an appeal or a dispute? How do I answer that?
Right. And that's all of these questions that you're asking is going to make it so complicated internally for the appeals process for these groups and for these plans. Because these questions that you're asking as a very intelligent person, somebody
recording this?
who doesn't necessarily, as a participant, have that level of understanding what to do, what path to follow, this is going to require a lot of coordination and logistics at the outset before you can even figure out, is this claim eligible for the NSA bucket, the appeal bucket, none of these buckets, something else? There are a lot of questions that have to be asked before you can even take any actions on a particular claim. They're going to need a lot of help to kind of work through this flow process to see how a claim is going to fall in. I don't think it's going to be something that's clear cut. And even more than that, remember the external reviews and the IROs? That was the extra layer that had been added for those non-grandfather plans.
Yeah.
So now, and we had to work with stop loss to make sure there was a rider if something was staying open longer than the period of time to make sure that claim would still be eligible for reimbursement. Well, that was only for non-grandfather plans. But under the NSA, guess what? There's an external review that's eligible for grandfather plans. So there's a different path and consideration here about when the external review would be applicable for a non-grandfather plan than NSA claim, which would be for a grandfather plan as well.
Great. So you hear that, stop loss carriers? I hope you're listening in because now you need to keep the claim open even past the policy year. And the question, of course, is I know with an appeal under the ACA, if an IRO tells the plan to pay more, most stop loss carriers will consider that to be allowable under the plan and therefore reimburse it if it's beyond the spec deductible. Well, now I have to ask the same question. What happens if in arbitration, right, this IDR process under the No Surprises Act, if the plan is required to pay more, are you going to cover that?
Right.
The same way you did an IRO in appeal. Okay, great question. So, and I can't wait until the claim is denied for something like, I don't know, medical necessity, exclusion. They file an appeal. It goes through the process. It's overturned because it is medically necessary, but it's out of network. So they pay it based on a reference-based pricing or UNC, and then the provider disputes that. So now the same claim goes through both processes, appeals and a
Needs a
dispute.
pen and paper to write this
So
all
it'll be
down.
like
Yeah.
5 years later by the time they actually decide what's payable. Oh my goodness, poor stop loss. Well, anyway, you mentioned the plan members, the participants, and how they're just caught up in this. Well, another area where they don't know what's happening and they only have the media to tell them what's going to impact their lives is this required vaccine or testing. And as you can imagine, it hasn't even been formalized yet. It hasn't happened in the
Right.
private sector yet. And we're already getting questions from our clients about this because, while it may not be required yet, certainly plenty of people have been receiving COVID tests. The claims have been coming in. And if it's required, medically necessary, we understand that's the current rule, right? Which, again, we won't get into whether this will apply in the future, but, either they've been exposed to somebody or they have symptoms, the plan is required to pay for it. Well, there are providers out there who have been taking advantage of that rule.
Sure have.
And Jen, I don't know if you want to tell us a little bit about what we've been seeing.
Yeah, so we know the rules right now, and we won't even talk about American Airlines and sort of how they're handling this. But when it comes to the COVID test, there are certain rules in place for what is required to be covered in the plan, whether you're symptomatic, whether you're traveling, whether this is something that's required for work or for employment purposes. There's lots of rules to sort of consider. And as we're seeing these types of tests come in, we look back to the CARES Act regulations a year or so ago, where it outlines what must be paid. And generally what has to be paid by the plan when it comes to the COVID test is either the cash price if it's listed or a negotiated amount. So there's also some questions here about whether the provider is actually listing what the cash price is. So if there is no cash price listed, are they paying these penalties for not having this listed? And how is the plan supposed to negotiate with these providers? What are they willing to accept? And if they aren't willing to accept a negotiated rate, does that mean that you must pay the cash price? And why that matters is because some of these COVID tests are wildly different based on where you're getting it and who is administering it. So this is going to create a lot of problems potentially for employers when they're not only going to have to offer this test if this is something that is being provided or required by OSHA and the DOL for their plan participants, but also for their employees, because this isn't a plan participant requirement if this is released. This is going to be broadly for everyone. So how are you going to balance how much you're going to have to pay and whether or not there is a negotiated rate because it's the plan versus the employee getting it as an individual?
Great. So we have statutorily supported price gouging. Basically. All right. Well, I got to say, I don't necessarily blame them. If there were a law that was passed and it basically said, hey, employers, you're required by law to hire the Phia group for subrogation, I think I'd increase my subro rates, especially if the pockets are deep, which, again, whether it's true or false, people believe that these health plans and health insurance carriers have this unlimited source of cash. Right? So they could charge whatever they want. Don't worry about balance bills. Don't worry about that. We got it. We got you covered. We're paying it left and right. So hopefully the arbitrators in the No Surprises Act aren't under that impression as well, because their knee-jerk reaction may be, I got to help these poor hospitals. Let the plan pay. So, I don't know where we're going with this, but it does seem like the answer to everything has been, when in doubt, let the plan sort it out, right? Let them pay.
And there are some FAQs that came out in the past week sort of outlining what you could and couldn't do, notably that if you are going to require the vaccine, can you charge a surcharge or an incentive? And the regulators did clearly say that if that's the case, it's something that you want to do for your plan, then it needs to be subject to the wellness plan rules, which we know there's lots of considerations there and criteria that must be met in order to ensure that you are in compliance with those rules. The other rule is, can you penalize people if they don't receive the vaccine? And generally, you cannot. So that's where we are for the rules. I expect that the DOL is going to issue those additional guidance shortly to tell us exactly what this will mean for private employers and mandating it and what that process is going to entail.
Got it. So, for me, and I'll leave us with this thought because it ties it back up to what I had said about us doing their dirty work for them. It seems to me like the easier thing to do is just to require the vaccine.
Seems so.
All this testing, the logistics, the pricing, who pays for it, the employer, the plan, how much can the provider charge? What do they have to do to get what they want? Are we going to be overcharged? Seems to me just you get the shot once, twice, and I don't have to worry about it.
Three
again.
times?
3 times the shot. Yep. So the point is, it's like, as an employer and as a plan administrator, it's just easier to require the vaccine, which I think ultimately maybe where they wanted us to end up in the first place. So
I think you outsmarted them.
wow. Well, with that in mind, speaking of painful injections, this has been a painful injection of knowledge on our part, but we appreciate you sticking with us, and come back in a couple of weeks for a booster shot. So on behalf of myself, Pat, the podcast producer, the triple P, the triple threat, the man, the myth, the legend over there at the booth, you're the man, Pat, and Jennifer McCormick, the senior VP, but don't let senior mean, senior as in a senior citizen of the organization. You bring youth and exuberance to the position and intelligence well beyond your years. And myself, Ron Peck, your CLO. I am so pleased to have had you join us for another episode of Empowering Plans with the Phia Group. Be well, stay safe, and we'll talk to you soon.